Welcome to The Better Life with Dr. Mary Ann Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mary Ann Pinkston.
Hey, everybody. I am Dr. Mary Ann Pinkston, and this is The Better Life with Dr. Pinkston. And boy, do I have a powerhouse for you today. I am so excited. I have actually had this beautiful woman on before. We've discussed kidney disease. But, you know, as those podcasts kind of fall down through the dates or whatnot, we've got to bring this back to light. And I'm going to do this often because kidney disease is a major killer of people. It's insidious and slow and silent. You don't know it's happening, and not only do you not know, but your doctor doesn't seem to know as well. And I have somebody on today who is changing that for the better. So I have Tiffany Jones Smith, who is with me again, as she's been on before. Go back and watch that show. Listen, this is the first African-American woman in Texas to a female to get to these heights of beautiful things that she has done for kidney disease. She's a patient too, and she'll tell you a little bit about that, but she's president of the Texas Kidney Foundation and also chair of the Chronic Kidney Disease Task Force here in Texas, works with Governor Abbott, who is working so hard to change things in Texas. Do not dismiss this man. He has done some great things in medicine lately, and rolling the dice and changing things, working against the grain. Tiffany, welcome. I am so honored to have you on.
Thank you. I'm honored to be on. Boy, I need you introducing me every place.
Oh, I'm going to follow you everywhere you go. You are my hero. So much. So thank you. But yeah, kidney disease. So tell a little bit about kind of what's going on with you and where you've been and what you're doing to change the face of kidney disease. But then, then we're going to jump in and talk about kidney disease. I want people to hear why their doctors don't understand it and how they can become an advocate for themselves and what can be done to save your kidneys. We can do it.
Thank you again for having me on. And Sweet. Kidney disease is something that we should all be talking about because 1 in 3 Americans are at risk for kidney disease. Yes. And it's, the biggest problem with kidney disease is that it's often seen in the blood and urine, but it's not reported to the patient until stage 3B. So it's seen in the early stages, but it's not reported until the latter stages.
Right.
And it's not some conspiracy. Because that is a problem worldwide, not simply in the United States.
Yeah.
And it's because of, how it's looked at, how kidney disease is looked at. It's in best practices, we're told by Kidney Disease Influencing Global Outcomes, KDIGO. They set the standard for the world of kidney disease. Every country in the world, every developed country in the world has representation on that in that organization, and they set the standards. Well, they set the standard as monitor. You monitor the patient when you see it in those early stages and diagnose at stage 3B. Perfectly innocuous, but it's being interpreted as let's monitor and not do an intervention or tell the patient about it because it's not attached to any of the protocols. So they have protocols for diabetes and hypertension, as you know, but it's not attached to those.
Right.
And, it needs to be.
Yes.
It definitely needs to be to the top of the thing.
To say the very least, yes.
But it's not that the doctors are up to anything. The doctors they have... Most physicians, if you talk to a physician, they are looking at those primary issues, diabetes, hypertension, cardiovascular disease, obesity. They're looking at that and thinking, hey, you've got plenty of kidney function.
Yeah.
Let me talk to Marianne about this diabetes and hypertension because that's the thing that's screaming at me. Right. That I need to do something about. And I've got protocols for that. I've got an entire intervention that I'm supposed to be doing around that. And there's nothing for kidney disease. So that therein lies the problem.
Yes.
Is that we have to get kidney disease attached to the protocols.
Yes.
And go from there.
Absolutely.
Educate those primary care physicians about kidney disease. They spend 5 to 7 minutes with the average patient. They are trying to triage whatever's going on that walks in the door.
Yeah, the fire that's there.
Yeah.
Fire, but not thinking on the prevention level early.
Yeah, exactly. And so, and some of that is we have to really demand more of the system itself. When people talk about systemic problems, often they want to talk about systemic problems in relationship to race, but the systemic problem that we have is truly a systems problem. It is exactly what it is. We got a problem with a system that doesn't work well, and the people that get punched in the face are the patients and the practitioners.
Absolutely.
Both are taking a licking, and they have to keep on ticking. Like the primary care physicians need, if we incentivize, everybody talks about incentives. The incentives should be placed on prevention. Yes. If we were compensating well, those primary care physicians for prevention, we would see everything move to that.
Absolutely. And if there was acceptance of the kind of newer protocols that we have, because we do have solutions. We have natural solutions. We have pharmaceutical solutions. We have so much power, to work on the preventative side. And we are not taught that in medical school. And the only reason I really know a lot about it and I'm very passionate about it is because I almost died of kidney failure. And that's where the light bulb went off. So I had to go learn that on my own as a physician. And so thankful. We can intervene, and we do need to. So we got to get the word out, and that's what Tiffany's doing. She's getting the word out.
Well, and that's what our I have to say, our governor, if you look at what Health and Human Services in Texas is doing, you start talking to the public servants that are in this state. Yeah. And the legislators. I have not talked to a single legislator who has not been on board with making people healthy, with trying to do everything we can do to get the correct therapeutics priced well so that people can afford them.
Yes.
Into the hands of the people that need them. Insurance
coverage. You can't. Time I prescribe a medication, they clearly deserve it, but the insurance does resist and does not want to cover. I have a man who has a GFR of 15. They still don't want to cover it, and they say he's too bad now. I'm like, no, let's do something. It's insane. But and on a national level, not to interrupt you, which I did, but on a national level, we want other states to see what Texas is doing, because I have many people who are watching from other states. And Texas, I am proud to say, because I'm from Texas, I'm proud to say that Texas is leading the way here. And that should be an example of what can be done. This should be nationwide. So define kidney disease and kind of what type of patient falls into that rabbit hole.
Well, 1 in 3 is at risk for kidney disease, and there's different types of kidney disease. I didn't even know this when I first got into what I call my calling, which is leading Texas Kidney Foundation, leading the team there, because it's a team. Yes. And it's a great team. I'm so blessed. God has blessed us. Mm-hmm. When I first got into this, I didn't know anything about kidney disease. I was a patient. We had lost 9 family members at that point. Now we're at 16 to kidney disease. And I thought it was something genetic in our family, and it is. Yes. There are genetic kidney diseases. We brought the first genetic testing in the country to our beautiful city, San Antonio, and began to really hone in on the different people groups here so we could see what was going on genetically. But there are genetic kidney diseases and, the what we all talk about, chronic kidney disease, and diabetes and hypertension, cardiovascular disease, and obesity really are your leading causes of chronic kidney disease. So that's the people. If you have diabetes, hypertension, obesity, or cardiovascular disease, or any combination of them, you should always have your kidneys checked. And it's 2 simple tests, UACR and EGFR, urine albumin creatinine ratio test, UACR, and EGFR,
Very simple.
glomerular filtration rate.
Very simple.
Those 2 simple tests,
Yes,
will give you a full picture of your kidneys. Now, when we first met, Texas Kidney Foundation was doing GFR.
Yeah.
We're doing EGFR. We have upgraded our lab to a medium complexity lab, and we have a wonderful medical director. And so now we are doing both. So
Right.
that when we come in and we're testing, you know what's going on with your kidneys.
Right.
You get a full look at what's going on with your kidneys.
Yeah.
And we also do genetic testing as well.
Yes.
So we've really been able to do some great work to the point where just 3 weeks ago, our research scientists, we won 2 National Institutes of Health fellowships. And we just presented at the Aim Ahead conference for the National Institutes of Health, to the National Institutes of Health people about kidney disease in this area, and really what leads to it. What do we see in the data that we have? We have this wonderful research scientist who she has brought us to a new level, I would say. But hopefully that answered your question.
Well, sure.
We can talk forever on kidney disease.
I really want people to understand that, we talk about diabetics and hypertensive, and kidney disease that affects your kidneys. And like you say, we just have this monitoring approach until it's at a severity where it's still, in my mind, just monitoring. And that's what I see a lot of physicians do, and even renal physicians. I'm not trying to put down any physicians that are around me. I have some great people I refer to, but I do see a lapse in speed as far as getting people treated. But I also see a lapse in the diagnosis. So if you get your EGFR and your doctor hands you your laboratory and you are starting to fall, I start to really pick it up when people start floating in that 80 to 90 and I see a trend, starting to go down. I really start looking at things very carefully there. And I notice a lot of other physicians look more below 50, getting into the 40s when we're escaping into an almost too late. We can recover it. I fully believe that. Many physicians have thought that is not recoverable. Once you have kidney damage, that's it, it's over. And it's not. It's recoverable. And so I've seen it a million times and I've done it. I've done it in my clinic a million times. The other thing too is when you talk about, so we focus on hypertension and diabetes, but we, like you said, obesity, insulin resistance, autoimmunity, just high inflammatory states, a high
uric acid.
Thank you. That was just about to come out of my mouth. And you and I've talked about this a lot. One thing that doctors hardly ever check and don't focus on is uric acid, a simple mineral in your blood that we need. But it's like anything. You don't want too little. You don't want too much. And the lab reference ranges are set very high. They go up to like sometimes 6 or 7 and say that's normal. And I'm telling you, 5 and below is where you want to be, and maybe even lower than that. So the reference ranges that doctors read are incorrect. And like I said, there are so many things that we do have that are not focused on that are greatly affecting the kidneys. I have a handful of male patients in their 30s, and I've seen this over 20 years. All this is clinical. I've just seen it. So therefore it's a pattern and therefore I accept it. And their uric acids will run, 6, 7, 8, 9 sometimes. And all of a sudden I start seeing their GFR come down and I'm like, wait a minute, there's an association here. We've got to jump on that and do that. And so I did this back in, early 2000s. I started to notice that.
And there is data to support that. Now, I just want to say this here. on this podcast.
Yes.
The first place I heard a physician, and the first physician I heard talk about uric acid, outside of the research physicians that I know, is Marianne Pinkston. First doctor I ever heard say that.
Wow.
We actually, when I told you that we upgraded to a medium complexity lab, we bought uric acid.
Thank you.
So we could test for uric acid, and we do that in community. Absolutely. And she is absolutely correct that there is a connection there. There's data to support that.
Absolutely.
And it's that kind of innovative thinking that, one, defines Texas. It defines us. We will see something and do something about what we're seeing. And that's how we came up with our campaign, Knowledge to Action, Neighbors Helping Neighbors 2030 Health Transformation, was because we saw that people just across the board, physicians and patients, didn't have the correct knowledge that they needed.
Absolutely.
To take the right action.
Absolutely.
And they just simply needed some transparency.
Yes.
Transparency. That's what everyone needs. It's not that we have a conspiratorial system. What we have is a system that is antiquated.
Yeah. Broken.
We have some of the best therapeutics on the planet.
Absolutely.
But people don't know about them.
And can't afford them.
They can't afford them. So, we had to advocate. That's why you see us doing so many things legislatively, as well as in community, because, one, you have to advocate with policy and policy change. And you'll see us with coalitions. We do a lot of coalition work because we go farther together. And I know that's a cliche or whatever, but it's the truth. Finding like-minded people who actually care about stopping the disease that is ravaging our world and ravaging our people.
Right.
I mean, think about what it was like when you were 300 pounds.
Yeah. Mm-hmm.
Your life was different.
Absolutely. Everything was different. Everything.
You can't. When I used to weigh 340 pounds.
Yes.
I couldn't look at my feet. I couldn't see my feet, people. Could not see my feet. Couldn't tie my own shoes.
Thank you. Couldn't cross your legs. Couldn't sit on an air.
My legs. I can cross my legs, see my feet, do everything. Because I lost 120, 130 pounds. Mm-hmm. I still have another so many pounds, like a lot of
you will do.
But it was life changing.
Yeah.
I mean, we're dealing with things that go beyond just a singular disease. The whole body has to be treated.
Absolutely.
You're talking about an ecosystem. You should see your body as an ecosystem and not just only as the kidneys. Yeah. Your kidneys tell you a lot about what's going on with you, and you have to have them. Yes. You really do need them. I mean, yes, you can have dialysis, but it's a last resort. It's not something you want to have. Absolutely.
Absolutely. And it is end stage. So, and not everybody can get a transplant. So that's that's not a solution. It's not dialysis.
And 80% of dialysis can be prevented.
Absolutely. How much? 80%.
80%. That is the evidence. 80% of end-stage renal disease can be prevented. I would much rather keep my kidneys. And I just, I typically do not tell people who my doctor is, who I go to see, what I do. Mm-hmm. But I actually see, Marianne is my doctor. She's my doctor. And the reason why she's my doctor is because, like, when my kidneys started going, because I have something called APOL1. It's APOL1 mediated kidney disease, AMKD. It has a name now. AMKD moves twice as fast as regular kidney disease. That's what characterizes it. It moves twice as fast.
Wow.
And so when we saw my kidneys not looking so good, she already knew, and I knew too, that there were SGLT2 inhibitors. We knew that.
Mm-hmm.
We knew it.
Mm-hmm.
Was there evidence was there what in the research world would say, enough evidence to tell us it would work on AMKD? We didn't know. Nobody was saying definitively that it would, but we did.
Why not?
Anyway. That's right. Why not? And here we are 4 years later, and my kidneys are great. I have last time we did my blood work, my GFR was 80.
Beautiful, yes.
Which is wonderful.
Which you would clearly be.
I would be in renal failure right now.
Dialysis are dead.
Mm-hmm. So, that was my options. But whereas with my younger brother, before we knew everything, he went into renal failure, and he has a wonderful nephrologist here in San Antonio. My brother actually would come to San Antonio to go to his nephrologist, whom I just adore, and they staved it off until he could get a transplant, and the two of them were just vigilant about it. It's practitioners are not out to destroy. They are out to save lives. I don't know a practitioner who got into this to do anything other than save lives.
Absolutely.
They're in a system that is not doing that.
Absolutely. They need tools. We need better training and better reference ranges and better knowledge. And, you mentioned the SGLT2, which is something that I went on before. This was just a diabetes medication. I had diabetes. And it helped with weight loss. It was before we had these lovely little shots that everybody has. And so I thought, and my blood pressure was just a little elevated too. So I'm like, okay, diabetes, blood pressure, weight loss, let's do it. All of a sudden I started seeing my kidney function coming up, and I took certain supplements because I go to A4M and learn the whole integrative, style of medicine and talk about cutting edge there and forward thinking and futuristic. And so, just put all those things together. And on that SGLT2, I swear I was one of the first people that ever recovered my kidneys on it. I swear. And so, so now the why not? Because the side effect profile and the safety of it is wonderful. And so the why not is there. The why not is all around you. And the doctor really should begin to think of the why nots and attack from that end. But our protocols have got to be changed so that doctors feel comfortable from a liability standpoint, to approach that. You're toying with somebody's life. You got to.
Yeah. And what you just said there, that's where physicians are coming from.
Yes.
They are trying to make the best decision they can make with the policies that are in place.
Absolutely.
So when we put in policies that support the evidence, that helps them.
Yes.
That helps them. They're not going to make I don't know a practitioner who's going to make a decision that is regarding your life without the policy to back it up. And that's where people like me come in. We have to come in and and make sure that policy is there to protect you, to protect the patients, to give you what you need to be successful.
Yeah.
I want to see that 80%, I'm all about knocking that 80% down. As many of the people as we can save, that's what we're going to do. Yeah. That then when we do that, if we knock that 80% down, guess what? Now we have enough kidneys to go to the 20% who do need a kidney.
Yes.
Now we have that.
Yes.
Yep.
It's all right. I can't really hear it. Yeah. Don't really
now
hear
we have that. If we knock that down, now we have what we need.
Yes.
To say that 20. Now we're not missing all these kidneys because we don't have that long waiting list.
Absolutely.
So prevention, early detection and prevention should be not just a chant, because I hear, I'm tired of performative organizations and statements.
Yes.
We've got to, that is why we put our money where our mouth is and go out and help people find out if they have kidney disease, find out if they have a genetic one.
Yeah.
And here are your options.
Yeah.
That's the point in doing that, is to give a person the best possible chance of maintaining and keeping their kidneys.
Absolutely.
And their health.
Yeah.
I would much rather have, and my brother will tell you this, he would rather have his original kidneys.
Absolutely.
And healthy.
Absolutely.
Rather than have a transplant. And he is a vigilant person when it comes down to his health.
Yes.
But he would much rather have that.
Yeah.
Than having to have had a transplant.
Absolutely. Now, you talk about vigilant about your health, okay? And young people, right? So if you don't have a genetic, mutation there that causes it to, go 2 times as fast, don't think that you're in the clear, because I can't, how many times do we hound, and I say this on the podcast over and over and over with every single guest, that diseases start in your teens and 20s, and it just takes all this time to develop. And there's so many things that you can do, to prevent that, but you need to have the knowledge of being able to go to your physician and understand what it is that you need and be able to ask for it. I don't know many physicians that aren't open, really.
Exactly.
If there's something I'm not, I'm kind of focusing on, like you say, the diabetes or something, and this is not what I do, but if I'm focusing on the diabetes or whatnot, and a patient, says, well, I'm interested in this and I'm curious about this, I'm like, oh yeah, let's move over here. Let's do that too. What can a patient go in and say and ask for in order to get appropriately tested and screened?
Well, the first thing a patient can ask for is their UACR, urine albumin creatinine ratio test, and their EGFR, estimated glomerular filtration rate.
So a blood test,
and a urine
test.
A blood test and a urine test.
Yep.
And I can tell you this, and your physician can assist you with this. The next thing you can do, what you can do every day, is your food. Your food. What you are putting in your mouth. Eating from the outside. If you don't get anything else out of this podcast, eat from the outside of the store.
Yes.
You want fruits and vegetables. You want, we do a program called Food is Medicine.
Yes.
Because it really is. It is the thing that will fuel your body or kill your body.
Absolutely.
And you want to give it fuel.
Yes.
And you can with fruits and vegetables, with lean meats, with things that do not have high phosphorus.
Right.
There's so much you can do with your diet.
Yes.
Nobody's asking you to be rail thin.
Yep.
A 10% change in your BMI is life or death for most people.
Yep. 10 to 20 pounds right there can change everything. And exercise too, and those things. And, we're not talking about buying a big gym membership or anything. We're just talking about focus and pay attention and lower your stress, all those things, sleep, all those things are so important. And so I want you real quick, we need to take a short break, and I want you real quick to let us know where we can find you. We've got a little bit more to talk about, very, very important. So I don't want people to skip out right now. But we will take a short break, and please tell people where they can find out more information.
You can find us at txkidney.org. Right. And that's our website. Just pop on and take a look at us, and you will see. And you can find a screening and where we're going to be. We've got a new thing called Wheels of Change, because we're going across Texas again. So hey, we may be somewhere near you. You need to check us out. See what's
absolutely. Please. And I will make sure we put that up. And I know you've got some events coming up too, here pretty soon. I know this is all Texas based. So my people outside of Texas, please understand this is a model for something you can do in your own state, and you can take action. If you have family members or yourself, we can answer questions too. And so, we're here for you. So please, a couple of events that you've got coming up.
Well, and I will say we're not all Texas based. We used to be all Texas based, but when we started doing this, we found that people needed us in other places, and so we have an event coming up on August 30th in Seattle, Washington.
Nice,
where we will be kicking off something called Knocking Out Kidney Disease with some junior Olympians with a wonderful organization called Champ Boxing Gym. Yeah. So Champ Boxing Gym does free boxing classes for inner city kids in the Seattle area. Beautiful. And we're going to be kicking that off with none other than the world famous Nate Robinson. Y'all all know him from him winning the slam dunk contest 3 times in a row. And jumping over LeBron James. I didn't know all of this about him before. That's
pretty cool there.
But Nate is a kidney transplant recipient. His gift of life he received on February 7th.
Yeah.
And we met Nate. When we met Nate, I met Nate. He thought that he was on a waiting list. And it took me about 20 minutes of talking to him to realize that he was not. And we began his transplant journey back in April of 2024, and he received his transplant in February of 2025 of this year. So he's such a joyous person, and just he brings a lot of joy to my heart and to the hearts of everybody. Beautiful. And he just has wanted to give back. He's big time pay it forward. I mean, just last week he was working with some kids at the transplant center, the children's transplant center.
Yes.
So we have that. Good. That's happening on August 30th in Seattle. We have a big event happening in Texas on August 30th also, where we're kicking off back to school and giving away 150 backpacks to kids in need in the 78207 zip code.
Nice.
One of the poorest zip codes in Texas.
Yep.
And then it's just been fast and furious.
Yes. You're a busy lady, that's for sure. So glad I caught you today. And you can find our previous show at drpbetterlife.com and all my previous shows, which I would be honored for people to come in and watch, subscribe, share, all of it. So we are going to take a very short break. Be back on the other side.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
Welcome back. I'm with Tiffany Jones Smith. I'm telling you, girl on fire. So, we were talking about, some of the issues and myths and things like that about kidney disease beforehand, being an advocate for yourself and taking control. And so, I know there's a lot of myths and we've touched on a few of them. So what other myths that can you think of that we can bust today? Because this is so important.
Well, I think that the greatest myth that we run into, or the biggest one of the bigger problems with genetic kidney disease is people feeling like that's it. That's the end.
Right. Yeah.
And it's the opposite of that.
It is.
With genetic kidney disease, once you know, then you know what you can figure out what your options are, what your practitioners can create a plan and a path, but you have to know.
You do. You have to know. And what if somebody runs into a provider that's resistant, for lack of training or, like you say, protocol support or all those things, doesn't feel comfortable maybe, or just flat out says no. People run into that all the time. I tell patients, I never advocate people leaving a physician, because sometimes you get frustrated and you have to start all over, and you start at the bottom, start working up again. And that's not always the best thing for you. And communication is very important. So tell me if there's something important to you, because again, I'm thinking about some other things. And so tell me. But what if they don't? And I tell patients that you have the right to seek care elsewhere.
Mm-hmm. Yeah,
I'm a hired hand here. I'm telling you, I'm a hired hand. And if you're not getting what you need where you are, fire me and go to some place where you feel represented.
Yeah.
What you need.
That's how I came to you. It wasn't that I had somebody that was bad, because I didn't. I just didn't have a person who knew what you know about diabetes and hypertension as it relates to kidney disease.
Yeah.
My kidney disease is a hypertensive related kidney disease, and I needed someone who understood that, who understood what the implications were, and who would work with my nephrologist. Yeah. Because I had both.
Yeah.
And it just, but really when you are working with a nephrologist, here's the bottom line to what nephrology is. There are a limited number of nephrologists in the country.
Yeah.
Typically, when you see a nephrologist, by that time, you've lost so much of your kidney function.
Yeah.
You really want to have your primary care physician looking at your kidney function all the time. Well, in my case, when we are dealing with me, because of how fast APOL1 moves, then we do my blood every 90 days, right? Mm-hmm. We're always looking at whether or not it's up and down. You got to have somebody. Everybody does not know to do that.
Right.
I don't have to tell her to do that. She does that.
Right.
I don't have to. She knows what she's doing. I don't have to. I get to go there and be Tiffany. I don't have to be Tiffany, the leader of the Texas Kidney Foundation, who's going to pound you into paste if you don't get this right. I get to be just Tiffany, patient. I get to be happy, friendly Tiffany.
Which is important,
Not fierce Tiffany, who has to go in and clear the decks,
Thank God I'm not in that pathway. But no, seriously, it's important. You need to be able to go where you feel comfortable being a patient, and so I just want people to understand that you can hire and fire any provider that you have that you don't feel represents what's important to you, and people now, they search on the internet, they search Google Scholar, Chat GPT, and all of that system. All those systems are getting smarter, and patients are getting smarter, and that's okay. It just means communicate, work as a team, and get to the right place together. Yeah. It's so important.
And you have to be informed. Like you as a patient have to look at, okay, what is it that I need to know? Like for us, we provide people with a heat map, the KDIGO heat map, and the reason why we love the tool is because it gives direction to the patient and to the doctor.
Yeah.
So it's a beautiful tool if it's utilized properly.
Absolutely. Absolutely.
And if as a patient, I've got to know what I have to do, because when I see you, and I see you every 90 days, or someone in the practice every 90 days, and that's 1 hour. The rest of the hours over that 90-day period,
right?
I have a responsibility and a culpability here. It's not just you. You are. I always see my care team as good advice and counsel. So I have picked good advice and counsel, but I have to be empowered to take that advice.
Absolutely.
Utilize that advice.
Absolutely. Thank you.
And do what it is within my scope.
Yes.
To do.
Absolutely.
Really, when you take that power, there is nothing more empowering as a human being than to know that you have some degree of control over this.
Yes.
And you do.
You do over many of your health issues, And so kind of as a last thought on this. So, we look at kidney disease, and again, we tend to focus on the big guns, hypertension, diabetes, and whatnot. And so inflammation, inflammation is something that I don't think a lot of providers spend time on as the root cause. So again, we want to go root cause here. We don't want to just pass out medications and placate a situation and slow it. We want to go root cause and treat and prevent.
You can knock stuff down when you go to the root cause.
You can. So I just want people to understand, go early. Go with somebody who knows how to, who knows how to find it and search it out. Someone who knows how to slow it, prevent it, get to that root cause. Start early and then take the advice and be your own advocate and work the problem and
look at your numbers.
Asked to do, look at your numbers. Yeah. All those.
You've got to know your numbers, know what those ranges are. If you don't understand something, ask. Tell them to explain it to you like you're a 2-year-old.
No problem with that, right?
So you understand, and anyone who tells you they don't want to explain it to you,
it's not for you.
Yeah, they're not for you because you've got to understand what's happening with you. It's the only way you can combat it.
Absolutely. And so, and take this as an analogy because let's say, yes, I know a lot about medicine and that's my avenue and my forte niche and all that.
He does.
But thank you. You're so sweet. Thank you. I just love what I do. That's all. But, it is, if I go to a mechanic, I don't know anything about cars. I'm going to ask questions. I'm going to try to figure this out. I need to be explained like I'm a 2-year-old. So it's okay. It really is okay. I'm here to explain those things and help you understand it. And I'm hoping that, other providers, are aligned with that, which you are correct. I don't know anybody personally that is not aligned with that, but the fault sometimes lies in our education and our liabilities that are hanging over us all the time and the insurances. And also please understand, that there are many physicians.
You're trying to do all of that and navigate that entire thing.
Juggle.
And that is why policy and systems have to be changed.
Yeah. Mm-hmm.
So that it's you're doing your job. You're doing what you got into this to do, which is to heal and not to hire a whole team of people just to translate the codes.
Right. The insurance
or for Medicaid or for Medicare or whichever you're trying to deal with. It shouldn't be that as cumbersome as it is.
Absolutely. It really shouldn't. So hopefully we are on that line. I know I have seen some changes in just this past year. I have seen some changes in the medical front of, additives in our foods and attacking the institutions to increase knowledge for physicians. I know Abbott put into place that physicians in Texas now have to have nutritional education and counseling. Thank God.
And that's a wonderful thing.
Oh my gosh.
That's a wonderful thing.
It is. And that shocked me. I'm just like, I see a trend. It's getting better, folks.
And that's the thing. This is the one area where we may be at odds with one another on everything under the sun, but there is one thing that we all agree on, and that is everyone needs good health. There is Texas is the 8th largest economy in the world. I treat Texas as if we are a nation because, one, we act like we're our own nation.
We do. Yeah, we got that attitude.
I'm in Texas. You got to act like we're our own nation because we are. But we have the economy, the eighth largest economy in the world. Yeah. You cannot fuel an economy as great as Texas if everyone is sick, if 1 in 3 people are sick.
1 in 3.
That constitutes a lot of people.
So this is something I wanted to ask you earlier, and you just brought that up again. And so what are the statistics on the future of kidney disease? If it's 1 in 3 now, if we keep going on this freight train we're on, what are the statistics of the future?
Which is why it is so very important that we do early detection. And because with 1 in 3 at risk for kidney disease, and 9 out of 10 of them not knowing that they have it, we've got a major problem because we have other things in this little ecosystem of ours, like COVID-19. That really exposed the issues with the epidemic of kidney disease.
Yes,
because COVID-19 acted as an AKI, an acute kidney injury, in a certain percentage of people.
Absolutely.
And it is still doing that.
Yes.
And so every time those individuals get COVID-19, they lose kidney function. Now, we know that I'm one of those people. That's why, that's part of the reason why we have me on the SGLT2 inhibitor. So you people are getting a whole lot of information about me personally today because I'm on here with my beautiful physician, and I'm always comfortable with her.
But it's good. It's good.
It's because I trust her. It's because I trust her, and that's what you should have. You should have trust. I pray for that for every single one of you. That you have someone like Marianne Pinkston that you can trust, that you know is leading you in the right direction. Amen. And I trust her not only with my life, but with both of my daughters, my husband. That she is the place she is our soft place to land when it comes down to our health. And even if it's the worst moment, I know I've got the best person in my corner.
Oh, thank you.
You should always be able to feel that about your
Absolutely. Physician. You made me tear up. Thanks a lot. So, thank you.
But it's true. And I'm sure that there are 100 other people that would say the exact same thing.
I was about to say 100 other providers that are out there like that too. There's got to be.
I'm sure there are other providers that are out there that are like that, but that what someone is like, it really depends on the two individuals that are sitting in that room.
That's right.
It's if I'm comfortable with you, I'm going to tell you everything that there is to tell.
Absolutely. Very important. Oh, you nailed that one.
And that's what you have to have. I mean, we come back to the same word, and it's transparency.
Yes. Absolutely.
You have to have transparency. Transparency for the physician, transparency for us.
Yes.
We have to feel like we can tell you everything, and you have to be able to receive it.
Absolutely. And bring it forward. Tiffany, this has been wonderful. We have hit a lot of wonderful things today. You have been such an angel and beautiful, beautiful human being. Say such nice things, and I appreciate that so much. It's not why I brought you on here, but thank you. But thank you. And, but you have been, at the top of the legislative run there in Texas and nationally, and you've done some great work. We applaud you so much. Thank you. You have saved a lot of lives, and it's so important. And I really wanted you here to clarify some of these things. Where can people find you? And,
they can find us at txkidney.org, and you can find a screening near you. You can find resources there, and it's a great place to get started.
It really is. And I know you've got some wonderful things. We didn't have time much to talk about it, but I know you've got some wonderful works in film and everything. You're not stopping here. Yeah,
that's right. We've got a movie that is world premiering in Hollywood on November 2nd. Mendez National Institute of Transplantation Foundation created the movie. It's called A Heart Full of Hope, and it goes along with our HOPE program, helping our people empower. It premieres in Hollywood November 2nd and in San Antonio November 8th. So you gotta come and see it.
Absolutely.
We'd love to have you there. You better come.
I told you I'm going to move heaven and hell to get it done. There you go. Follow your orders, or I tell you, you're great.
And it's in Spanish subtitles. I requested the Spanish subtitles so that our people, all of our people, can listen to it and learn about transplantation and their options.
Beautiful. Thank you for that. All right. And you can go to drpbetterlife.com, find our previous show talking about more about kidney disease and more information, and some others, which I appreciate. So, Tiffany, it's been an honor. Thank you. And we keep doing what you do, please. Please.
Thank you. Thank you for having me.
Absolutely. Everybody have a wonderful week.
You've been enjoying The Better Life with Dr. Mary Ann Pinkston. For more information, go to drpthebetterlife.com. That's drpthebetterlife.com. And listen next week for The Better Life with Dr. Pinkston.